Very good evening, friends. Today is the Hahnemann Day, 10th April. We used to celebrate the Hahnemann Day or World Homeopathic Day. And everyone is very enthusiastic on 10th April. But surprisingly, what happens from 11th April to next 10th April, the spirit is lost. This is what I used to observe many times. If this spirit continues, if this spirit is getting maintained throughout, the homeopathy will rule over the rest of the medical practices, definitely. One has to study the homeopathy in the similar manner as Hahnemann have developed the homeopathy. The way he worked very hard, right from the 1790 to the 1843 till his last breath, he has developed one typical pathway for cure. And that pathway we have to follow. What we are doing only following his books, following his whatever the literature he has written, and we are not going ahead. The pathway is to experiment, to do the experimentation. You have to go ahead with the experimentations and you have to come with new proofs. You have to come with new thoughts. You have to come with new understanding. You have to correlate homeopathy with the medical diseases. And from modern point of view, you have to show the correlations. You must develop homeopathy with a modern language. But this is not happening. And that's why my suggestion to all of you is there that you study the homeopathy the way Hahnemann have studied. So my suggestion to everyone, be Hahnemann and try to go ahead of Hahnemann. Then we can actually celebrated the Hahnemann Day. So with this introduction, today we're going to have a face-to-face session, question answer session. There are many queries arises in eager minds. When we start learning the homeopathy, the dynamic science, it is always happens that there are many questions develops in our mind. Because dynamics is the science where our original prejudiced material science gets contradicted, and because of which many questions develops. Today, that's why I have kept this open forum, question and answers. There was one question asked by Mr. Satyanarayan sir. It's a very good question which he has asked. He said that what was the incidence because of which Hahnemann would have aroused to the concept of potentization? That was the question he has uh, sent me on WhatsApp, and he has explained the two theories behind that. Sir, you must copy paste it over here also so that rest of the people also knows your question and your own theories, two theories behind the answer. So
Yes,
that
sir.
everyone, it will
No
be
problem.
visualized to everyone.
Yes, sir.
You just take it from the WhatsApp and paste it over there. Until that period, those who have any questions, you put it over there in chat so that it will be quite convenient for me to answer your queries. So, Satyanarayan sir's question was very good. What was the thought because of which anyone started doing potentization? It's not a day one process. It is not just a speculation. It is not a thought. What has happened, when he started practicing homeopathy, he was an allopath. And that time's fad was that to give the medicines in a material doses and larger doses. What used to happen because of larger doses of the medicines, along with the effects, there are many hazardous effects used to happen on the human body because of large content of the medicine. That was the first thing which has created in Hahnemann's mind what will happen if we reduce the dose? So he tried to reduce it step by step. If you would have given the 4 ounce of mother tincture, instead of that, he started reducing it to 3 ounce, then 2 ounce, then 1 ounce. So gradually, he he was using that in a decreasing doses, decreasing material quantity, and because of which he was satisfied even that dose was reduced. He used to get the results. He used to get the same results without causing a damage to the human health. And he considered that what is the dose which patient will require so that it will be quite convenient without producing harm to the patient. So when he reached to the zero level, then he started diluting it with the water. Then he started giving strokes to it because he was the physicist as well as chemist. And that's why he started using physics over there. And that's why he developed certain procedure. It is a long, tedious process of thinking. It was an inductive logic process which was developed in him by his father. And because of which he was ready to go ahead. So there was a continuous thought, what is next and what we can do. And because of which it was possible for Hahnemann to reach to that specific level, to go towards the potentization. When he started reducing, then he started giving the, he started utilizing first the trituration method. After that, for liquid substances, he has developed the succussion methods. These are different methods which it is a slowly developing process which was there in his mind with inductive reasoning, and because of which he experimented. It was not directly performed. He was experimenting everything, and because of which it was possible to get the results, and that was the data available with him. So experimentation was the basis of Hahnemann's inductive reasoning, and because of which whatever we used to get in organ of medicine is the result of pure experimentation done by Hahnemann. So it's a very good process, inductive process, which was there in his mind, which led him to reach to the concept of potentization. And it was a long, tedious story. So it was not early. When he introduced the vital force to the world in 1833, in the 5th edition of Organ of Medicine, at that time he was reaching towards that. So it is a gradual process with which he has reached to the concept of potentization. So that's my understanding about the how Hahnemann developed this idea of potentization. So, sir, you have explained the theories, 2 theories. The first theory was which you have explained over there is not the right one. The second one is definitely the same, that he started reducing the doses gradually and he found the results with gradual reduction of doses, and he continued with that. So that's the second one is very correct. So that's the answer of your question from my point of view.
Thank you, sir. Thank you, sir.
So any other queries? I am
Sir,
expecting
yet,
good many
yet
questions.
another one query, sir.
Yeah.
Sir, while taking Sabina, you told Sabina is mostly a female remedy, as per the Allen's keynote, that menstrual cycle, all these things, everything is concerned with the female. You told Hahnemann was a prover, and his son also was a prover.
Uh,
How, in that context, how he will only enjoy the pain, or how he will tell the symptom that menstrual cycles, all these things, no, will
no, no,
not
no,
happen to a male, no.
no, 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 no.
How it will be bifurcated?
First important thing, only two, Hahnemann and his son was not only the provers. They were two of rest of the provers. That is the first thing. Second important thing was that it is not a only female remedy. Yes, more aspect definitely female, preeminently female. Whenever the word is used preeminently female, preeminently male, it means it is more, the female part is more dominating in that specific remedy. Nakswamika, we consider that a preeminently male remedy. It means it has more stronger affection to the males than the females. Second important thing, that proving when it was conducted, it is not only on one or two provers. There are there were many provers. Only it was the interesting thing was that Hahnemann and his son was one, both of them were two of them out of the rest of the group. So that's the answer of it. So definitely the females were there, because of which it was possible to get the provings of female symptoms in Sabina. Okay.
Thank you, sir.
Any other questions, queries? You put your questions directly. Don't keep anything in mind. Whatever it may be related with homeopathy. You can put it over there also in chat box regarding the queries. Many questions arises in our mind whenever we used to practice homeopathy. There are many queries
Sir, yet
related.
another one thing, sir.
Yeah,
Sir, Bonihassan, Dr. Bonihassan's Materia Medica repertory, you told it is due to deductive logic,
inductive.
inductive logic,
Hmm.
but others belong to
Deductive logic.
deductive logic. Then how both can concur, sir? He is from general to the he is taking particular and he is generalizing,
Hmm.
and others were generalized and coming to the particular. How
Hmm.
both will concur? Whether all the symptoms, if there is a thumb symptom, whether it can be applicable to all our body, how that is little bit tricky, sir. That part is a little bit tricky. I could not understand.
First important thing for this, uh, understanding the Boning Hussein, we have to understand the human being. We have to understand the law of biological development. First important thing, this law is only three words laws. What is the law? Law is functions creates organs. That is the only three words are there in this specific law, law of biological development. Means what? Whenever there is a fertilization happens, there is it is a cell which is unicellular, which is one cell called as a primitive cell or a stem cell. When a soul enters over there, that is what we labeled by the name of vital principle enters over there, the further division starts. It was the same cell which starts developing, and functions are defined by the vital principle to the cells, that for few cells he says that you do the work of brain and they gets transformed from the same cell to the brain cells. To the others, it has been told that you do the work of GI tract, third, respiratory system, fourth, heart and circulation. So in this way, the first functions are defined. And after the functions are defined, then the cells started changing their shapes, their functions, and accordingly the functions are developed. So it was the first, the thought is there, because of which cell has converted from one type to the another type, but originally it is one and same. If it is made up of same cell, then definitely whatever is true for the part is true for the whole human being, because it is from the same cell, the rest of the cells have been developed. So the concept of generalization is very, very correct as per Boning Hussein who explained and developed this concept, it is very clear if there is any specific modality to the particular part, that cell, this modality is there. If we don't get anywhere any other modality, if whatever is true for the part is truly applicable to the whole human being. So if patient is saying, for example, in his mouth there is a burning and he feels better by warm drinks. So if you can directly generalize the modality, patient is better by warm drinks. Under the chapter modality, you open in Boningussen's therapeutic vocate book, open the modalities, find it out of amelioration, and find it out warm drinks. This is called as grand generalization. Because the cells are one and same, whether it is applicable to the particular part or to whether it is applicable to the whole human being. Very occasionally, in fact, very occasionally, one of the particular modality is different and general modality is different. It's once upon a time. Otherwise, it used to remain the same. And that's why Boningusen followed this concept of law of biological development, and he developed the concept of generalization in detail. And because of that reason, Boningusen have developed his repertory based upon this inductive logic, because of which if the patient is saying a particular thing, he was generalizing it. Going from particular to the general is the induction method of inductive logic, and that he is generalizing it in his repertory, and you have to find it out under the location, under the sensation, under the modalities, and under the concomitant, the generalized symptom. And that's why you have to go from particular symptom to the generalized symptom, and that's why his repertory is called to be a only repertory which is based upon the inductive reasoning. If we go with the Kent's repertory, we have to follow the deductive logic. Every chapter is different. You will have a mind chapter separately, the vertigo, the head, and the rest of the whole up to the generalities. 37 chapters in a row, where you have to locate the symptoms. First, if for example there is a pain in head, then you have to open the head chapter, then you have to go the main rubric pain, then under the pain you have to go to the sub rubric if it happens only at night, then if it happens specifically at midnight, then you have to go over there. So you are going from general thing to a very particular thing. Even sometimes some modality is there, the headache is aggravated by sun, so head pain in general, then you have to go to the level of circumstances or modalities, then sun aggravates. So you are following the deductive method. So you are going from general symptom to the particular symptom, and all the repertories followed this path. But because Mm. but because of which it was very in their repertories have been become very big. If you'll find it out the complete repertory, only mind session have a very big session. In fact, one repertory of Kent's repertory is like a complete repertory mind session. It has become so vast because it is based upon deductive, and every particular part and organ is separately given over there. As compared, Boningussen's therapeutic pocket book is really a pocket book because it has only 7 chapters. Grand generalization makes things very easy. When you follow the deductive logic, then you have to go to the very particular, and you never get every time the special characteristic modalities, special characteristic sensations, special characteristic concomitants with which it is possible to reach to the very particular remedy. That's why Boningussen's method, which is based upon the grand generalization and inductive reasoning, is much more easy than the rest of the repertoire. So behind that thought, behind the Bonnie-Hussein's therapeutic bucket book and inductive reasoning, there is a law of biological development with which we can understand, yes, the concept of generalization is true. Is it okay?
Thank you, sir. Thank you.
There is one more question asked by Dr. Prasuna. She says that what is the difference between the cup of Drosera and Drumex? Both have the tickling, correct? Both are the remedies from the same miasm. Both Drosera and Drumex, both are having a tubercular miasm in background. But Rumex, it is literally comparatively most acute than the Drosera. Rumex has a very acute curve. Even though it persists longer time of duration, it develops fast. There is a irritation in the throat, specifically at the pit of throat, that you can get over there, and even touching that part is so sensitive that it irritates the curve. Generally, it aggravates more in the morning or evening, which is dry cough. Very occasionally, the expectoration comes out in Rumex, and it is quite commonly a seasonal more. Drosera is like that, but Drosera is more deeper in action than the Rumex. Drosera is the remedy from tubercular miasm, not only covering the respiratory symptoms, but it affects the bones. It affects the spinal cord. It has the capacity to produce a pot spine. So it is a very important remedy in tuberculosis of the spine also. Here, the symptoms are long-standing. Second important, they are not, the way Rumex acts so fast, the Drosera takes a long time to act. And that's why if you open the Allen's keynotes, you will find over there in Allen's keynotes, in the end, he has written one specific sentence. You must read that. I have the book of, I will show you just a minute. It is too important what he has said. Hahnemann says, Materia medica pura, one single dose of the 30th potency is sufficiently to cure entire epidemic whooping cough. The cure takes place surely between 7th and 8 days. It is not instant. It takes long time to get cured. Never give a second dose immediately after the first. It would not only prevent the good effects of the former, but would be injurious. See, very clearly he has mentioned about the doses in about the Drosera. Drosera is not so acute. It's a remedy which takes its own time to act. And that's why we have to understand little bit. It is clinical understanding that we have to use when we deal with the patient. Rumex, the presentation is as acute, whereas as compared to Drosera, and Drosera is exactly opposite. Drosera, it is growing insidiously, reaching to the high, and it cures also even after giving Drosera on 7th or 8th day. So both of them from same miasm, both of them shows very similarity in their symptoms, but the presentations are different. So that is the difference between the cup of the Drosera and Rumex. That's what I understood. Any other query? Any other question? Don't keep anything inside, whatever it may be. You always have n number of queries in your mind. Yes,
Sir, if a patient has had tuberculosis and he has taken AKT treatment
correct.
and we are not getting any specific symptoms for any other remedy,
Hmm.
so can we first start with tuberculinum
Hmm.
and then till the symptoms become clear, then we can start with the other remedies?
Most important thing, if as far as ATT is going on or AKT is going on, it's better not to interfere, because with the AKT or ATT, they tries to um, recover, or they tries to kill the mycobacterium with the help of those specific drugs called as chemotherapeutic doses. Those are chemicals, very strong chemicals. Rifampicin, thiambital, isoniazid, all those are very strong chemicals. If it is going on, it is always better and safe not to interfere with any medicine. Once the treatment is finished and patient is recovered, to if you feel that patient is having some other symptoms and he wants treatment, tuberculinum can be one of the remedy which you can use as an antimiasmatic, but it is not always the tuberculinum. If patient's constitutional remedy is there, it is always better to give that remedy. But you should be cautious while using phosphorus, while using kalicarbonicum, and while using silicia. These are three remedies. You should be cautious when you are using it in tubercular cases. Second thing, if the patient is or patient has already taken the AKT and still patient is not recovering completely, he is again having the recurrence of it, and patient is not getting relief, and he is in acute state of the tuberculosis where he is having hemoptysis, then you have to think about the remedies which you can use during the active stage of the disease. Then you can think about the Acalepa indica, very good remedy for that. As iodide, which you can use as an remedy for open tuberculosis or frank cases of tuberculosis. But you should not go for Kalikap, you should not go Silicia. Silicia also has a capacity to dissolve the fibrosis which have already taken place, and if it gets dissolved, patient might have bouts of hemoptysis. Phosphorus is most dangerous drug. So these are the remedies. These three remedies you should be quite conservative whenever you are using, and if in during active stages you should not go for that. Later, yes, after a period of year or two, yes, you can go for it, but don't repeat too much. That is also one thing which I will tell you regarding the Kalikap, silicia and phosphorus. Okay.
Sir, can I ask one
Thank you, sir.
question, sir?
Yeah.
Other than homeopathy, it is related to medicine. How far you suggest this batch flower remedies, sir?
Yes. My aspect of looking batch flower remedies, that batch flower remedies works as a palliative. I have not seen a good cure with only with the batch flower remedy, unless I give the potentized remedies. For example, we'll take simple example ornithogalum, which is the star of Bethlehem. It is a batch flower remedy, but in batch flower I have not seen good results, but I have cured some the pyloric stenosis with the help of ornithogalum. I have utilized that ornithogalum in 30th potency, later on 200, and I have cured the case of pyloric stenosis with ornithogalum. So in potentized form, definitely it has its own action, own results. In in the form in which we used to use it in liquid form, called to be a mother tincture or called to be a dilution just, I have seen only palliative results with the batch flower. That is my aspect of looking the things, but I am using it since last 30 years. I have batch flowers with me. I have used all of them. Rescue remedy, very good remedy in active state to settle the patient's acute emergencies. Rescue remedy definitely works, but it palliates, it never cures the patient. So batch flower remedies are very useful to tackle the cases, but not for the curative purpose. This is my aspect of looking towards the batch flower remedy.
Thank you.
So my suggestion always for all of you, be there with queries. Queries are very important. Yes, last question will take that, how to identify aconite fever and belladonna fever. Aconite comes to you very acutely, the state of mind. He tosses in agony. He's in a very active state. He comes to you, doctor, please do something. Please do something. I will die. I will going to die. This is the active state. He's in turmoil. That is an anguish. Whether the patient is having fever, whether the patient is having heart attack, whether the patient is having dental pain, whether he's having headache, whatever it may be, his state of disposition defines the aconite. So the very important thing is that belladonna, pulsatilla, everyone has their own state of disposition. You don't have to look towards the fever. You have to look towards the person, aconite person's personality state, pulsatilla state, belladonna state, that you have to catch. Belladonna will come with the throbbing headache, throbbing carotids. Patient is again in agony, but not like aconite fever, not like fear, not like aconite anguish. There is complete absence of thirst during fever. Such types of differences which you have to look for differentiating the thing. So we have to be, we must know all those specific entities. So this is too important. In case of animal bite, what type of animal it depends. It is basically, my suggestion is that if it is acute and if it is like a dog bite, it is always better to go for rabies vaccine. Very important. So this is too important to go ahead with that because it is a material which has entered inside the body. But if it is simple insect poisoning, then we have better options. The APC is there. Even in dog bite, you can use the lysine, but you must use it as a preventive. We have belladonna, you have stramonium, but those cases, the 5 6 days back, there was a phone call regarding this rabies patient from Loni over here, and that fellow had a dog bite 8 days back. Then he went to the Pravara hospital. There was no vaccine available. He was shifted to Pune, then Nagar, but it was not available over there. Then he was shifted to Pune Ruby Hall. There was not available. Then they have sent it to infectious hospital. Then they have given the all rabies vaccine. But what has happened? They said that there is nothing wrong. He will not have. And all of a sudden, there was a call from his father that this has happened with my son, and he's told me the story. And now since morning, he's saying that I'm having fear of water. I'm listening the sound of water. This is the rabies typical symptomatology which has developed over there. So these are dangerous things. So what he asked whether you can do anything. I said first you admit him, because, and second thing, whoever may be in contact with that fellow, all of you first take the vaccines and then go ahead with the treatment. Because such dangerous hazardous disorders you have to manage, otherwise it is very difficult. So related with that, yes, definitely. Same is true with the snake bites also. You must know what type of snake is there. And your treatment basically based upon the rest of the symptoms, not directly with that, because originally patient has the material disease, not the dynamic disease. Homeopathy deals with the dynamic disorders, not with material disorders. So this is my answer regarding it. So I think there is only 1 minute is remaining. We'll conclude today's session. Thank you being there, and again a very happy Hahnemann Day to all of you. Nikita, I will next time I will talk about chronic kidney disease, my experiences whenever possible, definitely. So thank you everyone, thank you everybody, and have a happy Hahnemann Day. Good evening.
Thank you, sir. Have a good evening.